Welcome to Masquerade Designs Face Painting Clean Technique class. Hi, I'm Miss Gina. I'm a pediatric nurse and professional face painter. I've been asked by the face painting community to share my clean technique. In the past, I felt that this technique set us apart and really didn't share. But due to COVID-19, I feel ethically obligated to share my knowledge to slow the spread. This clean technique is approved by an infectious disease doctor. These are our options, but due to all states having different COVID-19 reopening policies, follow your state's policies and regulations. I want to take a moment to express that this class is for free, which generally is not. But you can also become a member, and that includes a questionnaire at the end of this course that proves that you understand the data that we shared with you. It will give you professional medical updates through the year, especially now that everything is changing so rapidly. You'll get a sign that you can post in the grass at your festivals that explain our clean technique so clients aren't wasting their time standing in line. And you can get stickers saying that you're an approved vendor for clean technique. In order to be a member, you do have to have proof of liability insurance. Let's begin with keeping your clients socially distanced at 6 feet apart in a line. At this time, face painters and clients are required to wear face masks while face painting. Since children are common carriers of COVID-19 without showing symptoms, you must assume that they're all positive and plan accordingly. You are only allowed to paint arms and a forehead. In addition to your face painting products, you'll need the following supplies: 3 opaque cups or disposable cups, a gallon of clean water, bin for used water and alcohol, brush bin, 2 complete sets of brushes, sponges, hands-free thermometer, wipes, hand sanitizer, latex-free gloves, goggles or a face shield, and Clorox wipes. Introduction. Keep it child-friendly. Children are going through a lot right now and they really need a break. Try to keep the process fun. Make a game out of it, make faces, whatever you usually do. Usually face painters are pretty happy. Sanitize your hands and put on a pair of fresh gloves. Put on a mask, shield, or goggles. Check your clients to make sure that they have their masks on, and then ask them to step up in line. Take a hands-free temperature and check for signs of illness: sneezing, coughing, open wounds, sores, lethargy, etc. Often parents will say, oh, it's just allergies, they're fine. But they're not. We can't determine allergies versus illness without blood work, so we can't paint children that have allergy symptoms. Let's say a client does come up to your line and they're sick. Give a free temporary tattoo to clients who cannot be painted and explain our policy is to keep all customers safe. This is also one of the benefits of having our sign. Our sign greatly reduces clients from standing in line if they're ill. Our sign states to call us if clean technique isn't followed, and this makes you accountable, adds professionalism, and is a selling point in which you can prove that you're a safe choice because you're held accountable through a third-party source. Also, a letter can be mailed to your client stating that you passed clean technique upon your request. Okay, let's get started. We help our client into the chair, we help them pick an option, we wipe off the arm or the forehead that we're about to paint, we throw that wipey in the trash can. We remove our gloves, we sanitize our hands, and we put on a fresh pair of gloves because we assume that our hands are now contaminated. I also ask the parent or guardian if it's okay if I wipe off the child's face and I show them the bag of wipes, and if I use latex-free gloves, just to cover all base to make sure if there's an allergy that the parent's aware of what I'm doing. Okay, so now we're going to add just an inch of water to the first and last cup. Fill the second cup with an inch of 70% rubbing alcohol. Now you're ready to start painting. You take your paintbrush, you put it in the first cup. You put it in your paint, you place it on the client's skin. At this point, you have a contaminated brush. You put it back in that first cup. Now that first cup has dirty water in it. Then you put it in the second cup and you sanitize it with the rubbing alcohol. Now you have to rinse off the rubbing alcohol and you put it in the third cup. Now the third cup with plain water is clean water. Now you can put it back in the paint and put it back on your client's skin, and you repeat the process. With practice, this process does get easier. Even if you just need a little bit more of the same color though, you'd still need to go through the 3-dip wash station. Be alert to where your gloved hands are touching. You can also use sanitizer on your gloved hands if you accidentally bump your client's skin. Earlier I said you will need a brush bin. My brush bin has 3 compartments. I add water to 2 compartments and soapy water to the third. When you're finished with that client, take the whole set of brushes you just used and wash them with soapy water. While that set is soaking in soap, use the second set of brushes for your next client. Your chair is now empty. Dump the first and third cup of water into the dirty water bin. Wipe the cups out with a Clorox wipe or a similar product. Remove your gloves, sanitize your hands, and start over again. Okay, proper care and technique of sponges. When we use sponges, we will spritz the cake, the split cake, with a spritzer of water. We rub the sponge back and forth, load it up really good, and bounce it on the skin or the face or wherever you're painting. Once we touch the skin, we can't put that sponge back on the split cake because that would be cross-contamination. So at that point, you can spray the sponge with more water and you'll be surprised how far the paint will go when you do that. But if for some reason you just ran out of paint, you can then put your sponge in a mesh bag and then grab a fresh sponge, but we can't put that same sponge, even if it's the same color, back on the split cake. After your event, wash your sponges at home with soapy water and soak in at least 70% rubbing alcohol for 5 minutes. Dry thoroughly and put back in your case for your next event.